Tonight we're talking about the midwifery crisis in Delaware and birth, the whole gamut. First and foremost, if you're in Delaware, please call your legislator and tell them how important midwifery care is. Tell them to vote no on House Bill 194, which we'll get into in a minute. If you're in another state, please call your legislator there and tell them how important midwifery care is to you, how important it is to your neighbor, to the women in your state, and how it can save lives. Give them evidence-based information so that they can make a good decision for your area. Right now, Delaware is looking like crap to the majority of other states in our nation. They're pointing at Delaware and they're saying, don't let that happen here. Act now before what happens in Delaware is happening here. We've got investigators going to our families' homes, families who had a home birth, who had a healthy baby, no problems, healthy mom, there wasn't any trauma. They're being greeted at the door by investigators who are looking for the names of midwives who tended their births. Now, in these cases, there were no midwives. One mom had an oops birth at home, and she was greeted at her door not just by EMT because her husband called 911, but also by the DA. And she was then escorted to the hospital by police for further questioning to see if she had a midwife at her house. Delaware women do not have freedoms right now to invite qualified and skilled professionals into their homes for pregnancy and childbirth. Delaware has acknowledged that certified professional midwives are qualified enough, they're skilled enough, experienced enough to tend to pregnancy and childbirth. We know that because we have regulations in place to license our certified professional midwives. The problem is, those regulations, which have been in place for over 10 years now, we haven't been able to license any new midwives and any new CPMs because they require written collaborative agreements with physicians, which they can't obtain because of malpractice insurances. Not only that, but now the Department of Public Health and sponsors of House Bill 194 want to increase the discipline already in place for those who practice midwifery without a license. And they want to align them with those who practice medicine without a license. Midwifery care is not medicine. They're two entirely different practices, two entirely different disciplines. They don't study medicine when they study midwifery care. They study midwifery care. But they can't obtain licensing to begin with, and this new bill, if passed, would impose higher fines and make our midwives felons if caught practicing midwifery care without a license, which they can't obtain. None of our CPMs, besides one who was grandfathered into the system and remains because she tends to the births of our Amish and Mennonite communities, none of them, needless to say, will practice right now because they have cease and desist orders already placed against them for practicing underground. But and now, if this bill passes, they'll be felons. And midwives aren't felons. They're not monsters. They don't practice medicine. Midwives are the experts in childbirth, which is a natural physiological part of life. They spend 3 to 5 years in school alone. Most of those hours are directly childbirth related. They apprentice with an experienced midwife. They take their boards and are certified through a national organization. We're talking about certified professional midwives here. They're the experts in childbirth. What do we need to do? We need to act. We can't just sit by idly and let this happen. We don't have any options right now. Right now, we either go to the hospital, which, you go to the hospital and you're introduced with actively managed labor, cascade of interventions. Over 1/3 of all births in Delaware are born via cesarean section or cesarean delivery. That's major surgery. That comes with its own large set of risks, including postpartum hemorrhaging, which is the leading cause of maternal death. So our only options right now are go to the hospital and deal with all that, or birth at home unattended or unassisted with no professional. We need a cohesive community, not split up. We recently had a rally. It was a very small rally It was effective, though. Because it's legislative season, we were hoping to talk with legislators, and we were able to talk to some influential folks. So that's very important. Even though it was small, it was very successful. The biggest problem with the rally is that some moms were told, don't go to the rally. They wanted a peaceful calls to action. And ultimately, the folks who told them not to go to the rally wanted to wait until next legislative season to introduce a brand new bill, hopefully get new supporters, you have to reinvent the wheel basically. Whereas right now, all we have to do is convince the governor that he should eliminate those written collaborative agreements, that part of the regulation. That's all we have to do. But that's okay, because we can wait a year or more, because it's going to take a lot longer than that to deal with an entirely new bill. In the meantime, our midwives are going to become felons if House Bill 194 goes through. We don't have time to waste. We have to take action. We need you to call your legislator. We need people to go to Legislative Hall this coming week. Tell them that midwifery care is so important. It saves lives. It is evidence-based. We don't need one person. We don't need two people. We don't need those two heroines to swoop in and save the day. We need an entire community here. We need you, all of you, to step up, step out, call your people. Go visit your people. If you know a representative or a senator, give them a call. Now's the time to call in that favor. We have an amazing opportunity to turn this birth crisis around in Delaware and come out ahead. Our legislators could help make birth safer in not just Delaware, but in states across the country, merely by helping Delaware women gain back our rights to invite midwives into our homes. I hope that you call. Please call. Tell us how it went. Tell us who you talked to. Tell us if they even knew about this beforehand. Call.